So, as a community, we decided to create a medical legal partnership with the idea of embedding legal aid into the healthcare setting. And the idea was just that we would extend our reach into our remote and rural communities that were off the road system. But it turned out that partnering with our healthcare partners, we learned a lot from the way they were doing things. And it ended up being transformative. We learned about behavioral health aides and community health workers and behavioral health aides. So these are all mid-level practitioners who are providing really quality healthcare services to people in remote communities. They are people from the community that have been upskilled to provide basic healthcare services that doctors aren't providing. And when I learned about this, I thought, why aren't we doing this in the justice space? And that's when the community justice worker model in Alaska was born.
What is true for healthcare, I think, is also true now for the question of justice. Is it just one professional who is responsible for taking care of everybody's justice concerns? Or is it possible to see how we can address the needs of justice with a team? The question then is, then who should be on that team? And I think the obvious answer, and one that excites me, is also seeing how we can take the lessons from healthcare in building teams of individuals who can provide the highest standard of care and create teams now in justice, including lawyers and community justice workers, to provide the highest standard of justice.
So we decided to partner with Ascendium and the Education Design Lab to stand up a national task force on community justice worker training and credentialing, because as this movement is advancing, really the question becomes, how do we assure quality, that people are getting the quality legal help that they need without being licensed attorneys?
By expanding the number of community justice workers across the country, we are embedding legal help right into the moments where people need help most.
The community justice worker can not only make sure that more people have access, but also can be a force multiplier for those who are already in the healthcare professions or those in the legal professions to be able to extend their reach, extend their expertise to the people who need it most.